The stigma and discrimination associated with TB among the greatest barriers to preventing care seeking and as a result causing further infections. This year's national theme for World TB Day is Invest in Action to End TB Now. This call urges South Africans to invest in their personal health through platforms like TB Check Mobile, which provides an easy mechanism for TB self-screening. To tell us more about this, we're joined from Pretoria by Dr. Jürgen Pillay. He is the country director for the Clinton Health Access Initiative. Dr. Pillay, thank you so much for your time this evening. This year's national theme for World TB Day, Invest in Action to End TB Now, but it goes further to say, get screened, end stigma and save lives. Tell us how this TB Check mobile platform that you're backing and doing in partnering with the National Department of Health as well as the Pray Health Foundation. Tell us how this platform ticks all of those boxes as set out by this year's theme.
Good evening, Marcel, and good evening to your viewers as well. So, in South Africa, we have about 150,000 people who have TB annually, who are not diagnosed or not on treatment. And, each person who is untreated and has active TB can infect up to 15 people in a year. So, it's very important that we find people with symptoms of TB and get them diagnosed and put them on treatment. So this TB check process works very simply. So if you dial on your mobile phone *134 *832 *5#, you will get to a screen where they will set out a number of symptoms. And, we know what the symptoms of TB are. They are coughing consistently for 2 weeks, chest pains, night sweats, and loss of weight. So you go through that symptom check and they will then the phone will refer you to where you can get a diagnosis and treatment. Alternatively, if you don't want to use that, you can WhatsApp 0600 123 456, type in the word TB, and again, it will give you a list of symptoms. You can check those symptoms and again get referred on. Our aim, Marcel, is to get about 1 million South Africans checking for their symptoms using these two access points. One is the free service, and the other, the WhatsApp, of course, is you have to pay for it. So you can use either service to access TB Check, and you can check your symptoms and get referred on. We have to find the 150,000 people, or close to that as possible, annually, put them on treatment so that we can curb the number of new infections we have in the country.
It's a little bit ironic that, repeatedly during the last 2 years of us battling the COVID-19 pandemic, I heard repeatedly from scientists and experts in the research field saying that South Africa has learned so much from its experience in its community programs dealing with TB and HIV/AIDS, and that has put us really in a good position to go about dealing with COVID-19. And yet it's that exact COVID-19 that has put the fight against TB on the back foot. How confident are you that we can make up that lost ground, that the health minister there at the World TB Day event admitted that we've lost because we've been so focused on COVID-19?
No, that's absolutely true. We have lost some ground, but it's recoverable. And I think the good news is that civil society, academics and government have had meetings with the minister and the deputy president to come up with a plan that will recover the ground we lost during the last 2 years. And I'm confident, working together between government, civil society, as well as the private sector, we can recover the ground. Marcel, the issue with TB it's not just a health issue. It's an issue that requires a multi-sectoral approach and requires significant input from communities as well. And I think certainly civil society has stepped up, as has government, to work together to recover the ground we've lost. But not only that, to do better. We have to ensure that we end TB as a public health threat by 2030. That's less than 8 years from today. So we really have to do more. And one of the things we've got to do is find people with the symptoms of TB, put them on treatment and ensure they're cured so they don't spread the disease. We also need to do other things, of course. We know that TB is a disease of poverty. We've got to do more in our country to ensure that people have access to nutritious food, to jobs, to better housing. Ventilation, we know, is very important, as it is for COVID. So there's a number of things we need to do to combat TB. We know what needs to be done. The minister has promised additional investments in the health sector, and the deputy president has promised political support for the campaign to get under the TB program. So I'm quite convinced we'll be able to do it, but we can only do it by working together.
Yeah, indeed, because a lot of what you've spoken about and what people need to know that they have access to, those medical resources is really at the feet of the Health Department to provide. Talk to me a bit about the Clinton Health Access Initiative and how this mobile platform speaks to what you do as an organization. Is innovation at the core of what drives your work, and how do you bring that together by working in an environment like in South Africa, where, yes, you've got a lot of people who perhaps respond to this kind of innovation, WhatsApp lines and that kind of thing, but you also still have a lot of people who need that face-to-face community interaction to get the information and the help that they need most?
No, absolutely. So the Clinton Health Access Foundation, an initiative, was founded by the former President Clinton. And it started with looking at improving access to HIV treatment and to reduce the cost of antiretroviral drugs. We now work in TB, in maternal and child health, in malaria, and in a range of program areas. Our main focus is to help government at national, provincial, and district level, as well as at facility level, to improve the way in which services are rendered, to decrease the costs of providing services, and to ensure ultimately that we have better health outcomes, whether it's reducing the incidence of TB or reducing the incidence of HIV or reducing maternal and child mortality. That's what we are about. And you're absolutely right. Our job is to find those innovations, show that they work, and then work with government to scale them up. And TB Health Check is one example of innovations that we're working with the Department of Health and our partners, PRACALT, together with the Bill and Melinda Gates Foundation, to show that this works, and it works for people on the ground so that they can get better health care when they need it.
Okay, we're going to leave it there. Thank you so much for sharing that information with us. That's Dr. Jürgen Pillay. He's the country director at the Clinton Health Access Initiative, telling us more about the TB Check mobile platform that they're scaling up in partnership with the National Department of Health and the PRACALT Foundation. If you want to find out more, you can WhatsApp 0600 123 456. 0600 123 456. And according to what he's explained, it takes you through a very basic TB check to monitor your symptoms and to give you an idea as to whether you should go and get extra health care.